Okay, so I think we'll get started. So hello everyone and welcome to our webinar today, Eating Disorders in Youth, a webinar for parents and caregivers. This webinar is a collaboration between Jesse's Legacy Eating Disorders Prevention and Awareness Program and the BC Children's Kelty Mental Health Resource Center. My name is Michelle Horn and I'm the Program Manager for the Kelty Mental Health Resource Center. Before we begin, I would like to respectfully acknowledge the land on which I am joining from today is the traditional territory of the Coast Salish peoples, including the unceded homelands of the Musqueam, Squamish, and Tsleil-Waututh nations. Before I introduce our speaker, just a brief overview of what the Kelty Center and Jesse's Legacy offer. And we'll be putting our contact details for both of our organizations at the end of the presentation. So the BC Children's Kelty Mental Health Resource Center is a provincial mental health and substance use resource center for parents and caregivers of children and youth, as well as individuals of any age with a disordered eating concern. We actually have a whole website specifically related to eating disorders, which we'll put at the end of the presentation. Jesse's Legacy Eating Disorders Awareness and Prevention Program is actually a program of Family Services of the North Shore, which offers counseling, support, and education for individuals, families, and youth across BC. Jesse's Legacy provides access to eating disorders resources, tools, and information for individuals, families, and educators. They coordinate awareness activities and events, including Provincial Eating Disorders Awareness Week, or PEDA, and they also offer school presentations for knowledge and prevention. A few housekeeping notes as well. So as I noted on the first slide, all attendees are automatically muted and your cameras are turned off, so we can't see or hear you, so you don't need to worry about that. If you have any questions for Joanna, you can submit those to the Q&A function, and there has been an option enabled where you can vote for questions that you want to see answered that have been asked by others. If you have any technical questions or comments, you can submit those to the chat function, such as how to access the recording or slides for the presentation. At the end of the webinar, a survey will pop up that we invite you to complete. Your feedback is really helpful for us for improving our webinars and ensuring we're getting you the information you need. The webinar recording and the slides will be made available on both the Kelty Center's and the Jesse's Legacy's websites shortly following the event. And just a reminder that the information in this webinar applies to the context in British Columbia. If you're in another jurisdiction, please consult your local health and school authorities for further information. To introduce our speaker. So we're really pleased to welcome Joanna Zelichowska today to speak. Joanna is the manager of Jesse's Legacy Eating Disorders Prevention and Awareness Program, which is a program of Family Services of the North Shore. Joanna is also a registered clinical counselor and a passionate advocate for raising awareness and decreasing stigma around eating disorders. So thank you, Joanna, so much for being with us today, and I'll pass things over to you.
So thank you everyone for joining. I just wanted to begin with a land acknowledgement. So I'd like to acknowledge that we're fortunate to be able to gather, live, work, and play on the unceded traditional territory of the Musqueam, Squamish, and Tsleil-Waututh nations of the Coast Salish peoples. I'm coming to you, zooming to you from East Vancouver today. And yeah, so to just begin by overviewing our learning objectives, which hopefully is what enticed you all to join this webinar today. So I'd really like to focus on understanding the spectrum of disordered eating, and not only kind of eating disorders, but how it impacts people beyond that in the larger scope. Really learning how to recognize those early signs and symptoms, how to know when we need to seek additional support. And most importantly, really, I want to leave you with some practical strategies for creating a supportive home environment and tips for how to talk to your youth and kind of start that dialogue if you have concerns. So I wanted to begin by kind of grounding us a little bit here in just our understanding of eating disorders. So for many families, shared meals, dinner time, celebrations are all opportunities, meaningful opportunities to feel connected, to feel plugged in, and to understand what's going on for our teens in that moment. And so as a result, it can be extremely anxiety provoking if you see that your youth is struggling with their relationship with food. It can be difficult to understand why your youth may be using food in a way that's harmful to them. And, you know, I think this tension can create distress, friction, withdrawal, and just generally a breakdown in communication. And all of those feelings are normal. So as I said, a moment ago, I really want to leave you today with some helpful ideas about really how to kind of contextualize and understand from the perspective of what might be going on for your teen, and how we can lay that groundwork for really creating an open, supportive communication and preserving the relationship, which I know, can be a challenging task with teens and adolescents, irrespective of what's happening. So that's kind of my goal for today. And to begin with, what do I mean by the spectrum of disordered eating? So I just want to note that this graphic is not an exhaustive list whatsoever, but it's just intended to illustrate a bit of what I mean by this spectrum, and specifically that kind of gradient nature of these behaviors. So beginning on the left-hand side, that's where we see kind of a normal, healthy relationship with food and body. So that looks like body acceptance, perhaps even I like referring that to that as body neutrality as well. Healthy, normal eating habits, which in my view, that means listening to hunger cues, incorporating a wide variety of foods. And as we start to move into that center bubble that you see is kind of bracketed there in terms of disordered eating, we can start to see restriction of real focus and preoccupation with weight or shape, striving for perfection, whether that be kind of a thin ideal or leanness, muscularity, however that looks, fasting, yo-yo dieting. And I just want to note, I think it's important to think about kind of how does society's messages play into this spectrum, right? And in what ways has kind of disordered eating and diet culture talk become normalized? Certainly in our society and the media, I think we can all agree that that's very prevalent, but also just I invite you to reflect on, how might that show up in our homes, amongst our peers? So something to kind of keep in the back of our mind. As we start moving forward closer to the right, you can see some of the examples of behaviors here that are listed are more harmful behaviors. So potentially purging, steroid use, laxative abuse, compulsive overeating, excessive exercising. And here I also want to invite you to think about the experience of boys. So I know typically eating disorders do disproportionately impact women and girls, but we're seeing more and more disordered eating and body image concerns showing up for boys and men. And I think, there's increased pressure in recent years in terms of marketing to boys, pressures, if you might think of from sports, certainly teasing and weight-based bullying, or perhaps this notion that I often hear when I go into schools around teasing and weight-based bullying, that it shouldn't affect boys or that it shouldn't make them self-conscious. And we kind of recognize that could be harmful for girls, and somehow it's not quite recognized in the same way for boys. So I just wanted to make a note of that. And then, of course, as you move over into the right-hand side of this diagram is where we see the clinical eating disorders. So anorexia nervosa, bulimia nervosa, binge eating disorder. And the one that's not listed on there is other specified feeding and eating disorders, which is essentially like a category that captures perhaps subclinical presentations of these three disorders, so maybe not quite meeting all of the criteria, or perhaps a blend of features of a few of these. So that would be the third one, and I know that's a mouthful, so the acronym for that is OSFED, Other Specified Feeding and Eating Disorders. So I'll use that shorthand moving forward. And yeah, so I mentioned, and on that graphic, it said kind of healthy eating on the one hand. So I thought it might be helpful to talk about what's the difference between dieting and healthy eating. So as I mentioned, disordered eating, diet culture, I think has really been normalized in our society. It's a common conversation that permeates so many aspects of our lives. And really what I think about is what distinguishes healthy eating from kind of a dieting mentality is in healthy eating, we're having adequate nutrition. We're eating an adequate amount of food that's meeting our nutritional needs. It's balanced. It's inclusive of a variety of foods. We're focusing on improving the quality of the foods that we eat. And really importantly, there's freedom and flexibility. So on the other hand, dieting we see as restrictive, restrained eating, perhaps omitting certain foods or entire food groups. The focus is often on limiting the quantity rather than addressing the quality of the food. And there's very commonly some rigid rules. The next component, which I feel really strongly about, is this idea with dieting that we label foods as good food or bad food. Now, that might seem kind of innocuous at first, but I think when we label foods as good or bad, we're actually applying a moral label to something that has no moral value, right? Food is not inherently good or bad. And the reason why I caution against using that language is I think it can be a slippery slope in terms of when I eat good foods, I feel good about myself. When I eat bad foods, I may feel bad. So you can see how that can trickle into having an impact on our mood, our future decisions about food, feeling guilty. Whereas an alternate to that would be to consider foods as, some alternate language could be everyday foods or sometimes foods. So using that language means that all foods are acceptable and can reasonably fit in our diet. There just might be things that we eat more often or more frequently and things that we don't have as often. Another thing could be kind of more nutritionally dense or less nutritionally dense, but they all have a place in our diet. And really, the important piece around healthy eating is that it's based on internal cues of hunger and satiety, and it's a long-term strategy. So alternately, dieting is really based on external cues. So whether that be, that's where those kind of rigid diet rules might come in. So calorie counting, not eating past a certain time, et cetera. And it's really time limited. And just a final note I want to make that this table was created by my colleague Helen Young, who's a wonderful registered dietitian at VCH. So that's what I see as the difference there. And then in terms of kind of drilling down disordered eating versus eating disorders. So disordered eating behaviors and chronic dieting, we know from the research, are major risk factors for developing an eating disorder. Individuals with eating disorders, by definition, will exhibit patterns of disordered eating. However, not everyone that experiences disordered eating will develop an eating disorder. And I'm sure we all have examples of this in our life when you think about folks who might have a long history of dieting or poor body image or relationship with food, but that doesn't turn into an eating disorder. That being said, there is research that shows that approximately 35%, so over a third of quote unquote normal dieters will develop some disordered eating behaviors. And I think the important thing to think about in terms of distinguishing when something kind of crosses that boundary from being disordered eating to an eating disorder, we're really looking at frequency and severity. And so that's in terms of behaviors that are going on, and the amount of preoccupation or distress that these behaviors cause for the individual. And then certainly impact on functioning. So what I mean by impact on functioning is how is this affecting your teen's quality of life, right? So are you able to fully participate in your life, or are these behaviors and preoccupations showing up in avoiding social gatherings, avoiding eating in restaurants, not wanting to go to the beach? So that's how you can kind of think about whether it's impacting functioning. And just to kind of make this even a little bit more kind of concrete. So in disordered eating, it might be the case that not all symptoms are present in order to receive a diagnosis of anorexia, bulimia, binge eating disorder, or OSFED. Or it might be that simply the frequency and severity doesn't quite meet those clinical thresholds or cutoffs. But this is so important. What I really want to drive home is that Disordered eating does not need to meet the threshold criteria for a clinical eating disorder in order to be harmful, to be life-altering, to impact somebody's quality of life, and to be worthy of getting support. So that's really important. Your teen might not look sick or underweight. They don't need to look sick or underweight in order to be suffering. And you cannot tell whether someone is suffering from an eating disorder just by looking at them. Now, when we think of contributing factors, so eating disorders are notoriously complex, they're nuanced, and there's rarely one specific thing that is going to be a cause or a trigger. So each case is unique, and there's likely to be a variety and a combination of pressures or challenges that might be contributing to that development. So this little Venn diagram on the right might showcase some of those things. So in terms of psychodevelopmental factors, bodily changes, that could be puberty, life transitions, whether that's, elementary school to high school to university, divorce, changes in friend groups, moving, etc. Sexual or gender identity issues, wanting to, for folks who might be transitioning, thinking about how to achieve a body that appears more masculine or more feminine, might be a vulnerability to engage in behaviors that might be harmful in order to achieve that. In terms of biological factors, there could be a family history of eating disorders. There's some evidence that genetics might play a predisposing factor. When we think of personality structures, I think of things like a tendency towards perfectionism, which could be a vulnerability, or low tolerance for change, or just sensitivity to stressors. And in terms of sociocultural factors, I think that's some of the things that we've been talking about, in terms of peer influence, media, diet culture, family values in terms of is thinness and appearance and aesthetic a high value, a history of trauma. And to speak a little bit further on kind of some contributing factors. So I mentioned puberty, right? So there could be a pressure to maintain weight as puberty hits. And, we can think about how we can do work as parents to offset that, right? And that comes in the form of education, preparing teens for the bodily changes that they're going to be experiencing. Adolescence is the greatest and fastest period of growth outside of that prenatal period. So it's a really, really incredible and intense growth spurt. So we have to anticipate and know that that's normal and expected. Certainly pressure from athletic involvement or peer groups. So being mindful about sports that place a high value on aesthetics. So if you think of even things like wrestling, football, there might be a focus on muscularity, strength. Sports like track and field, running, there might be an emphasis on leanness, lightness. And then kind of traditionally aesthetic focused sports you might come to mind are, dance, ballet, gymnastics, diving, swimming, all of those things. And that's not to say that any of these sports or things are inherently bad or we should prevent our children from participating in them. I just want to encourage a mindfulness about being curious about, how your child's feeling when they're engaging in these things, being curious about attitudes of coaches and their beliefs, and challenging unhealthy behaviors if you notice them, or speaking up about that, or attitudes that might come up. Certainly this is not limited to athletics as well and could show up in peer groups. There's a strong social focus on eating clean or keeping fit. I think that's quite prevalent in the Lower Mainland, where there's a lot of value and, again, perhaps moral value or judgment placed on health and wellness. And I mention these things in the sense that these are all things that we can point out and have conversations with our teens and youth and encourage kind of a critical dialogue about that. Relatedly, family beliefs about size and shape. If we're making comments about other people's appearance or our own appearance, or can we be really thoughtful about showcasing and pointing out diversity and how wonderful that is. Certainly the next few things are things that are not kind of motivated by body image and could just be life stressors. So increased stress levels in whatever form that takes. As I mentioned already, kind of life transitions, challenges, changing responsibilities, lots of that happening in the teen years. Emotional coping or avoidance. So specifically when things feel chaotic or when there are things that are outside of our control, it can be tempting to seek a sense of order by focusing on things that you can control, right? And that might show up in the form of focusing on diet and exercise. Low self-esteem, internalized ideal of thinness. So if we really believe that there's this one standard of aesthetics that we believe to be the highest value for ourselves, that could be a risk factor. What we call fat talk is this this self-deprecating language about, an example there, oh, I look so fat in that photo, or perhaps like using hyperbolic language to describe our bodies, like, oh, I look like a whale in that, or something to that effect. So really being mindful and conscious of the language that we use, and again, how we speak about our bodies. And certainly, as I mentioned, weight-based bullying and teasing could also be a contributing factor. Now, moving into signs and symptoms of an eating disorder. So the way that I organize this, the next couple slides I'm going to spend talking about this. I'm showing you things initially that kind of represent the progression of those early signs and symptoms that might show up, and then how that might progress to more pronounced or more significant signs and symptoms. So preoccupation with weight, food, calories, nutrition. I think what I want you to keep in mind for this list in particular is just noting and clocking for yourself if you see changes in these areas, or how that might be shifting and evolving for your youth. So sometimes we can see an intense interest in food but not consuming it. So that might look like cooking, baking for others, wanting to prepare food but not wanting to eat it themselves. There might be a refusal to eat certain foods, or perhaps entire categories of foods, like no carbohydrates, no fats. You might notice that there's a shift in terms of comfort level of eating in front of others and not wanting to eat in front of others. There could be food rituals that show up. A few examples of that might be excessive chewing, or not allowing different foods to touch on the plate, or pushing food around on the plate, or taking quite a long time that's shifted in terms of the time it takes to complete a meal. New practices with food or fad diets. Certainly if you're noticing portions reducing or skipping meals altogether. One thing that I always like to mention, but I didn't explicitly say here, because if we think of changes in diet in terms of a switch to veganism or vegetarianism, certainly there is nothing wrong with veganism or vegetarianism as a dietary choice. But I think I want to caution you to think about, if those changes are occurring, to be curious about, there's many good reasons to adopt those diets, but to just have a conversation to see if they can articulate why that might be important to them, and to evaluate whether it's potentially being used as a way to justify not eating certain foods or not eating out in certain spaces. So as long as there's adequate nutrition and enough being eaten, those things are not a red flag in and of themselves. But again, as I said, just clocking and noting for yourself as these changes occur. Certainly a preoccupation with body shape, size, that might show up in the form of body checking. So looking in the mirror, looking at clothing, how clothing fits. Perhaps body checking might look like touching, measuring, feeling kind of folds of skin or perceived fat, focusing on perceived flaws. You might see an increased intensity of mood swings. And then a significant one, I would say, is withdrawal from friends, social activities, or hobbies. And you can see how many of these items in isolation might just be common things that you can expect to see in adolescence or as a result of hormone changes, right? Like mood swings in and of themselves, I'm sure are quite common for all adolescents. But again, looking at kind of that, observing that larger spectrum of behavior and seeing how these things are evolving. Now, as I'm moving forward here, looking at a little bit more significant signs and symptoms as things might be progressing, that might look like noticeable fluctuations in weight, perhaps a change in how they're dressing, wearing more baggy or layered clothes, potentially to hide weight loss, gastrointestinal issues that might show up, so cramping, constipation, reflux at a time where that wasn't prevalent beforehand, irregular menstruation for cisgender females in terms of missing periods or perhaps a delay of onset of menses altogether, difficulties concentrating, sleep disturbances, and then as you can see, getting a little bit more significant in terms of dizziness, fainting, lightheadedness that might come as a result of low body weight or changes in body weight or blood pressure. There could be abnormal lab findings in normal blood work, so low iron, low thyroid or hormone levels, low potassium, red and white blood cell counts being lowered, and that might show up in terms of impaired immune functioning, so getting sick frequently, slower wound healing, and then again, continued here in terms of more significant markers that might show up like cuts or scrapes at the top of fingers or knuckles as a result of induced vomiting, perhaps excusing themselves immediately after meals to use the restroom. Dental issues that could occur from vomiting could be cavities, tooth discoloration, erosion of enamel, observing some swelling or puffiness of the face that might have not been there. As the diseases progress, there could be changes in skin, hair, and nails in terms of brittleness, dryness, hair loss, feeling cold all the time, and then further into the progression specifically with anorexia nervosa, the development of hair on the body and face. So that kind of looks like a fine peach fuzz, and that's called lanugo, which is the body at that point attempting to stay warm by stimulating this hair growth. And so I know that was a long laundry list of things that we just went through, but in terms of how to know when to get help and how to kind of contextualize all these pieces for yourself, I think generally the greater number of symptoms that are present and the greater those things are evolving, the greater the risk. We know it's been demonstrated time and time again in research that the sooner help is accessed and treatment is accessed, the prognosis and outcomes are better, and there's better chances of a quick recovery. All of that being said, if you have concerns about any of these things with your youth or see any changes, it's important to start a conversation, and it's never too soon to start that dialogue. So we'll be moving into talking about that in a moment, but I also just want to highlight a few things in terms of when it would be really important to involve a medical professional, and that's definitely if your teen is underweight. So that is a general kind of BMI marker of about 18 and a half below, but certainly if you've seen a concerning change in weight, that's something to investigate. If you're seeing fasting, skipping meals, or eating very little, certainly exercising too much or too often, or perhaps seeing that there's anxiety happening if they're unable to exercise. Or if there's a strong drive to continue exercising in the face of injury, fatigue, or in place of other activities. And then definitely if we're observing anything like vomiting, laxatives, or any other medications that might alter shape or weight. So that could be diet pills, things like ephedrine, fat burners, things like that, anabolic steroids, etc. Now, I wanted to also just ground us a little bit too in terms of what this experience might be like for your teen and to help understand how can we be most effective in our approach. So the thoughts that your teen might be having about food and body image may totally seem illogical or irrational to you. Eating disorders can have such a powerful influence that it's often been described as a voice. I don't mean voice like in a hallucinatory sense, but that there's this clear pressure, right? It's that extreme self-critical, persuasive, persistent voice. And this is very real. It can be very, very frightening. And it's just so important to note that your teen did not choose to become unwell or choose to become sick or intend to create worry or heartache for your family. Even as frustrating as that might seem at times, that might seem like what's happening, I assure you it's not. Again, just in terms of understanding their experience, remember that your teen's focus on eating, body image, and exercise is serving a purpose. So symptoms are often, if at least initially or temporarily, working to be effective in some way. So they can be effective in managing anxiety, stressors, and this can happen by providing kind of a false sense of control or distraction away from other things that might be going on in their life or that they feel they have little control over, challenges, intense feelings, life changes, etc. Add to that, you know, weight loss is so strongly reinforced and rewarded in our culture that this often seems like it's working quite well for them, at least initially. And for all of these reasons, it can be really scary for your teen to think about changing their behaviors or beliefs. And this is often where parents are noticing that these things are a red flag and they're becoming concerned. So you're the one that's going to likely pick up on these things or want to flag them as a concern, and it may not be your teen coming forward saying that this is problematic for them for all those reasons, and the fact that that can be so reinforcing or feel like it's working well, especially at the outset. So in terms of moving into how do we have a conversation about this, I really think that the most important thing is to think about our stance. And when I say stance, I'm referring to our tone of voice, our body language, our approach in general. And the more that we can work towards being compassionate, providing an open, secure space, being curious and non-judgmental, the better. I think it's really important to pick a time that is relaxed in order to start having a dialogue about this. My advice would be to avoid meal times in terms of starting this kind of a conversation. I know that that can often seem like a good idea because it might be happening there and in the moment. And so it's a natural segue to have that conversation. For example, oh, I see you're not eating this, or you're having a hard time with your dinner, and then going into this whole list of concerns or things that have been going on. But understand that meal times are probably, if your teen is experiencing some of these things or beginning to struggle with food, that's a very tense time. There could be a lot of defensiveness or denial that would come up, or just challenging to just fraught with a lot of intensity and emotion. So I would really encourage you, even though it might seem like you're raising this out of the blue, to broach this topic when you're in a relaxed space and you have time and no less pressure in order to be able to have this conversation. It's important to ask open-ended questions that create space and basically creating this foundation of starting a dialogue, right? So things like, how have you been feeling today? Or I noticed maybe things have changed with your friends, or you're not hanging out with them as frequently. What's going on? And you'll notice, like in that question, we're zooming out and we're looking at what else is going on in the child's life. So we're not focusing on specifically food or exercise. You don't even have to mention eating disorders or disordered eating. Just start by cultivating space for this dialogue. I'd recommend avoiding closed questions or questions that have a yes or no answer, because I'm sure many of you that have teens know that one word answers can be quite common. So things like, did you eat lunch? Yes or no. it doesn't really leave space for continuing that conversation. It could also be kind of perceived as confrontational at the outset. So even if they're not taking you up on the offer to engage in dialogue, the more that you can continue to be present and approach and reinforce that I'm here if you want to talk to me, you can take it or leave it. We don't have to talk about this today, but continually showing up so that they know that they can take you up on that, or they might start to have a conversation after the fifth invitation. And really reminding your child that you love them no matter what. I know it can be incredibly frustrating to see these things happening or changes occurring and feeling like you have no control, and it's hard to understand, but that reminder can be so impactful and really in terms of preserving the relationship. A little more kind of specific advice in this realm is, in that initial conversation, try just to simply start voicing your concerns rather than approaching it in a confrontational way or in a way that's directly challenging or their behaviors or accusing them of behaviors. Again, really wanting to set up this foundation that we're creating an openness for a dialogue, and that is not, this isn't going to be a single conversation. So you don't have to achieve everything or get all your answers in that one conversation. So thinking about focusing on what you're actually observing and how you're experiencing your teen. So not focusing on commenting on their appearance or changes in their appearance or changes in the food, because I assure you they're already hyper-focused on that. So example might be like, I've noticed that you're not quite acting yourself lately. What's that about? Or I've noticed you're spending more time in your room. Can you tell me about that? And again, this is likely not going to be one conversation. This is going to be many. It's also probable that there could be a variety of responses to that, right? They could shut you down. They could say, no, I'm not talking about this. There could be denial. There could be anything as a start. So really, that's what I want to leave you with, is that it's not a single talk. So you don't have to put that pressure on yourself to achieve that in the first conversation. Now, having said that, I think there is a caveat here that I want to highlight, and that is, if your child is medically unstable, severely underweight, or in need of medical intervention, we do need to act, right? It's not about waiting until they want to have that conversation. Things do need to happen. However, I think thinking and keeping in mind those ideas about stance can really be valuable. We're showing our youth that we are wanting to maintain their autonomy, wanting to kind of hold that respect. So even when it seems like there are no choices or no pleasant choices, we can still create that atmosphere and that stance. So for example, like if your child is low weight and needs to go to the doctor and you're wanting to investigate this, going to the doctor, seeing a medical professional is the part that's non-negotiable, but that we can have some say in how that happens. You can talk about what would feel best for you in the way that we did that. Do you want me or dad, or who would you like to accompany you in that? Or maybe there's another trusted adult you could that they would prefer. So that's kind of an example of what I mean, where there might be some spaces where you need to hold a firm non-negotiable, but you can still kind of cultivate that openness, curiosity, and encouraging choice whenever you can. And in that way, I think that stance is empowering in terms that it helps you to align with your child as, what are you and I going to do together about this problem, rather than feeling like it's you versus them or you versus the eating disorder. Let's name that as part of what they're experiencing, but calling your child alongside with you to say, how can we best do this together? So that's what I mean by that kind of stance. And in terms of kind of some final tips moving forward, as hard as it is, I know this is much easier said than done and typed on a slide, but avoiding blaming yourself. It's really important to acknowledge that you might never know what triggered these behaviors in your teen. And really the most productive thing we can do is focus on accepting that this is an illness or this is happening, and focusing on incorporating as many positive supports and working towards recovery. There is no benefit in staying in that place of blame. And in terms of things that you can do to continue to support yourself, that doesn't require your child, is learning as much as you can about eating disorders. I think seeking information is going to better help you to understand their behavior, their feelings, their mood swings, and specifically things that, might be really challenging to wrap your head around in terms of, this seems illogical. Like, for example, your teen is insisting that they're overweight when they clearly are not. You don't have to agree or fully understand that, but try to work on accepting that this is what feels really true to them in that moment, and how can I be compassionate to that experience that they're having. And then finally, just really continuing while this is going on to continue eating normally as a family. It's important to uphold that kind of modeling, that your teen sees your family enjoying foods, enjoying normal helpings. As I mentioned kind of throughout this presentation too, being mindful of not making appearance or diet related comments about yourself, about others. I think that modeling of acceptance of size and diversity can be really powerful. Keep including your teen in family and social events, even if they don't join in. You can work on building their self-esteem by really pointing their attention to the qualities that you value about them that are not based on appearance, not based on aesthetics, right? You're so kind, you're a wonderful friend, your integrity, your intelligence. And lastly, really seek support for yourself if you're struggling. It can be, this is a large load to navigate yourself, and it can be so helpful to have a sounding board to express worries and frustrations, and you don't have to do this by yourself. So that's what I have for you today. I've also listed where you can go to get more help. I'm glad that we'll be moving into some Q&A here, and some wonderful resources that you can access in BC. Jesse's Legacy, the Kelty Mental Health, of course, Looking Glass, or to speak to your family physician. That's just lots of good information and resources on our website, or you can reach out directly to us to chat about these things or to navigate when and where to access supports, and certainly the Kelty as well. And yeah, now I'll invite Michelle back for some Q&A conversation.
Thank you so much, Joanna. So much valuable information and practical strategies and tips packed into 40 minutes. So thank you. Thank you so much for all of that. And thank you to all of you who have submitted questions so far. So just as a reminder, if you do have a question for Joanna, you can ask that using the Q&A icon that you can see at the bottom of your screen. And there is an option where you can submit questions anonymously just by checking the submit anonymously box if you prefer to do that. There's also an upvoting feature, so you can look through the questions that have already been submitted, and if you see one that you also have, you can click on the thumbs up underneath the question, and that will upvote it to be answered earlier. So with no further ado, we'll jump into questions. So Joanna, there's actually a few different questions asking about what to do if a child refuses to get help and continues to deteriorate. So could you speak to that, what to do when the child is just refusing to get help?
Yeah, and I think that's the piece that I was mentioning at the end there, that we can try to hold as much supportiveness as we can while being really firm and clear about what the non-negotiables are. So if your child is refusing to eat and deteriorating, then that is a risk. They're medically compromised. They might become medically unstable. And importantly, when a child is underweight or refusing to eat, that impairs their cognition or their ability to assess whether they're at risk or not. So as kindly and as gently as we can hold space to say, I understand that this is painful, this is scary, I know this is unpleasant for you, but here's the non-negotiable. We need to go speak to a medical professional, but you have some choice in how that goes. And I would like you to be a part of that as much as possible, right? So within that, we're trying to hold the frame of these are the things that need to happen, acknowledging that I know that sucks. This is hard. But at this point, it's not up for discussion, and we need to go speak to somebody. Now we can talk about how we can best do that and how you would be most comfortable doing that. But I'm sorry, this part needs to happen. And I know that is the most challenging part. I completely empathize with that. But I think that's that balance between, and I think another piece that I would say to that is the more that you can be as transparent as possible about the process and not having it be a surprise. So trusting them to engage in that conversation to say, these are the steps we need to take. This is how it's going to happen. This is when it's going to happen, so that they can do their best to prepare for that. But that, I'm sorry, it's not an option that this does not happen. We need to do something about this, but I want to bring you on side and to be as much on board of this process because I know it feels like this is really scary and it's happening to you. So these are the things that we do have a choice in. Would you rather it be mom or dad, or maybe there's a trusted aunt or somebody that you would feel more comfortable with, or maybe you would like to have some time to speak with a doctor by yourself, and then I will come in and join, and then we all have a conversation together. So I know it's not challenging, but that's how I would recommend approaching it.
Thank you, Joanna. And then a few follow-up questions to that, just about, what happens when those non-negotiables don't work. I know that we need to act, but how the police won't take to the hospital unless under the Mental Health Act, and you can't force them. So just what if those non-negotiables don't work?
Yeah, well, I think that's where you really need to have conversations with the physician. So I know not all family physicians are as well versed or understand the risks of eating disorders. Some are really wonderful and some have less knowledge about that. If you feel that your child is medically unstable, we need to find a physician that will be on board, that can fill out a referral to a program or get them admitted to emergency if that's the case. And I know we're talking about teens and youth, and so there's a little bit more that you can do in that respect. Older teens and adults, this becomes more challenging and heartbreaking. But if you're interacting with a physician that feels like it's not necessary or dire, and you're really clear that this is not working for you, then I would encourage you to find another physician. And that's some of that work I've done with parents as well, in terms of finding someone, preparing questions for the doctor, having things pre-planned, because it is so highly charged and emotional, and it can be very overwhelming and frustrating when you have a short window of time to speak to somebody. So speaking to somebody like at Jesse's Legacy to help you think through what are the important things that you want to communicate, what are the things that you need to ask, and what's the medical risk that you're seeing that you want to have assessed. And that might mean going into emergency as a last resort, but we're also available to help parents kind of navigate that. I know that's the most challenging and heartbreaking part.
Thank you, Joanna. So the next question is from a parent who is asking if there is a danger in using the words eating disorders in conversation if you're not sure if that's what's going on. So is there a risk of identifying with something that isn't happening by using those words?
I mean, as I said, you can choose to not say those things initially, and really I do encourage parents to zoom out and talk about the things that you're observing, right? So what you're observing are behaviors, changes in mood. You're not observing an eating disorder, you're observing them. So the more that you can keep that language really tangible and concrete about what you're seeing, I think that's helpful. And you're right, I think for some teens, that could be very scary to hear that word. It could be off-putting. It could create some defensiveness and some pulling away. So if your sense is that that might be the case, then I would encourage you to, it's not necessary to use those words. You know, talking about risks about eating disorders or the potential medical consequences. I think sometimes when we're in a place of fear and anxiety, we want to go there to say like, this could happen, this could happen. Don't you know, to try to raise that alarm so that they're feeling that kind of sense of urgency that you are. But I think ultimately that's not a very helpful approach either. I mean, we see this in so many different avenues where, you know, if we knew smoking was bad for us and all of those things, that would be enough to kind of stop us from that behavior. So I don't think it's necessary to kind of have that labeling. I think I would encourage you to, especially if you have that sense that that could create some defensiveness, to talk more about the things that you're observing. And as an initial inroad to that, talking about the behaviors and how you experience them outside of the food and the appearance, because like I said, they're probably already so hyper-focused on that. So, you know, your moods really change, or you seem much more withdrawn, or you're not engaging with us the same way that you were. And then using that as a foundation to elicit more responsiveness and try to cultivate a conversation from there.
Great, thank you. So the next question is, are all eating disorders related to appearance? My daughter doesn't seem concerned about her looks, and her lack of eating seems more related to control issues and only wanting to eat very few foods, mostly junk food.
Yes, yeah. So definitely you're right in that it is not all appearance or body focus based. There's so many different factors that can play into this. Certainly that, you know, as you mentioned, that sense of control, particularly when things are feeling chaotic or there's things that are outside of their control, it can manifest in, well, that's something that I actually is in my realm day to day, that I can see what I'm putting in my mouth or what I'm doing. And when I divert my focus to those things, it might not it might not be connected to a particular outcome or wanting to achieve a body type or whatever, but that this, the function of focusing on this relieves me from anxiety or thinking about other things. So certainly that is possible for sure, and quite common as well. So it does not have to be connected to that body image. It is common for a lot of folks. It might evolve and change, but it's certainly that kind of fixation or control piece that was mentioned. That's definitely a factor, yes.
Thank you, Joanna. So the next question is from a parent who says, my son is 11 and the son is beginning to binge eat the sometimes foods. He is now overweight per the doctor, but has positive body image. So asking from a perspective of having a genetic history of eating disorders for many generations. So the parent is wanting to support positive body image and not trigger, but balance health. So any tips for that parent?
Yes, yeah, wonderful question. So I think really focusing on health in terms of behaviors and not about, I would encourage you to not think about restricting foods or changing diet, but encouraging more positive options, right? So including a wide variety of foods that they can make choices about, including different kinds of activities that are fun, that they want to engage in. So it's not exercise or diet to change the shape and weight of your body, but let's explore things that really make you feel good. And when do you feel your best? What are the things that you do and eat that make you have the highest energy? And this can be done in a really neutral way, right? Like if you think about, if I were to eat nothing but chocolate cake all day, I probably wouldn't feel very well. At the same token, if I were to eat just broccoli all day, I don't think my stomach would like that either, right? So can we cultivate more of an awareness of what makes me feel good, what makes me feel energized, and what are things that we can do together as a family that encourage those behaviors, and really being mindful about not sending the message that you need to, when we feel good and when we feel positively, we're more likely to take better care of ourselves. So it's not about dieting and it's not about exercise or changing weight, but just making all of those positive options available.
Great, thank you. So we'll try to squeeze in a few more questions if we can here. We have about 5 minutes left. So the next one is asking, is it harmful to have the child or youth sit at the table with the family during mealtimes?
Is it harmful to have them at the table? No, I think that's is that, I'm wondering if if the child or youth is already experiencing an eating disorder or just in general. I'm going to just speak to, I think the family meals and shared meal times are a very positive thing. I would be mindful of positive modeling, so including a wide variety of food, normalizing eating desserts, eating all kinds of things together, being mindful that we're not talking about diets or talking about foods that are not okay, or if there's somebody that's on a specialized diet or has certain dietary considerations that need to be taken into approach, that's clear and transparent and understood why, and that we're not modifying the way we're eating to impact our shape and weight. So that's not being modeled. But I think it is important to have that. It can be a very protective factor to have family and shared meal times together. So I think that should be encouraged.
Great, okay. And so one final question. So someone is asking if there's, if you know of or if you would recommend group therapy for young men or women who are recovering that will share experiences, and what your thoughts are on that?
In terms of, I think hearing other voices and stories can be quite powerful. That could be helpful. I think groups are a wonderful way to do that, and to also recognize some things that might be present for themselves that they might not have had awareness about. And when you can see that reflected in another person and sharing their stories, there can be a lot of light bulb moments that can go off. And I think that's one of the wonderful benefits of group therapy, as opposed to a more individual style of therapy or one-on-one, where you're only kind of delving into your own experiences. So I think that's quite positive. And actually we're doing we've got a Q&A, it's not a group, but just a Q&A blog series on our website right now that shares people's diverse experiences of how their eating disorders began and what was helpful and what was unhelpful, to kind of see that and normalize and kind of destigmatize all of the various kind of avenues and trajectories that could happen, in order to kind of raise awareness and help people recognize that. So that's something that we feel passionately about as well. And I know there's not a whole lot of groups that are available, unfortunately, in that realm, but I do think that that's a powerful and positive tool.
Great. Thank you so much, Joanna. So I think that's all the time we have for questions. But as mentioned before, please feel free to reach out to either the Kelty Center or Jesse's Legacy if we didn't have time to get to your question, or if you think of something after the webinar, we'd be more than happy to support you if you reach out to us. And Joanna, if you just wanted to go to the last slide there with our contact information on it. Great. So here's our contact information here, the Kelty Center. You can reach us at our 1-800 number from anywhere in BC. And that's also the Kelty Eating Disorders website that I mentioned that has information on it, as well as additional resources and our contact details. And the Jesse's Legacy information is on there as well. So feel free to reach out to either Kelty Center or Jesse's Legacy. We'd be happy to support you. Thank you, Joanna, so much for your time today and all of the wealth of expertise that you bring to this topic and that you were willing to share with us today. Thank you to everyone who joined us today. We really appreciate it. And just one final reminder, there will be a survey that will pop up when we end the webinar. And we'd really appreciate it if you could spend 4 or 5 minutes just filling that out to let us know how we can improve or enhance future webinars, and also what other topics you would be interested in. So thank you again, everyone, for joining us today.
Thank you so much.